many series that I did on acute webinar series. I did one on rare remedies. Then I did one on hormonal series where I spoke about thyroid and PCOD research work that I'm doing, and also now I'm doing about nosode. So it's been an absolutely crazy month for me, one of the best actually. And I did work a lot on myself. I did a lot of work on myself, and things did work out for me. God has been kind. So let's continue Boericke Materia Medica series. I don't want you to stop. Don't stop for me. Don't stop for anyone. So Boericke Materia Medica series. Let's talk about today's remedy. We are talking about Coccinella sempactata, which is a ladybug, an insect remedy. Very lesser used remedy, interestingly. There are two or three things I want to tell you about. Number one, very, very, very important remedy for any kind of neuralgia. And the keynote of neuralgia is there's a lot of salivation or accumulation of saliva in the neuralgia. And very, very important, there is a throbbing sensation in the tooth and cold sensation in the teeth. Typically, the neuralgia is in the frontal area, and the pain goes from the right eye, and it starts from superior molars to the forehead. So typically, we think left side is spigelia. This is a very important right sided neuralgia remedy. And slightest brightness, light, etc. aggravates better by sleep. So it could be a very, very, very important remedy for neuralgia. I think it's one of the more lesser known remedy for neuralgia. And I told you, I do a lot of work on neuralgia. I have, if there is one disease after hormonal disease like thyroid, PCOD, where I feel that homeopathy is like beyond other sciences, it is neuralgia. I have many cases of neuralgia, and I want to tell you this, hand on heart, hand on heart. I haven't seen a case of neuralgia where I am not able to help the patient. And there is no arrogance that I'm talking to you about. It means that that is the result that homeopathy can give. Sure, my first remedy may not work, I may review it, but if you sit with the patient, and I remember one Dr. Barwalia saying this very interesting. He said that sometimes the if he gets about 4 or 5 months with the patient, he will review the case again, but at some point he will find the remedy for the patient. It shows a lot of confidence, but it also shows a lot of practicality. Very interesting. Coccinella sempactata, that would be the most important thing for me. Yes, there are pain in the region of kidney, loins, icy cold, extremities. But the thing I want you to remember is about the neuralgia. Maybe I want to tell you one or two remedy more. This is Cochlearia aromaraceae. This is horseradish. Interestingly, what is it well known for? Interestingly, it is very, very well known for this, for dandruff. Many Indian homeopaths use this remedy for dandruff when there's a lot of dandruff. I've used it a few times where I use a few drops of the potency, and I tell them to put it in water and apply it on the hair, and sometimes once in a while it has worked. It hasn't really helped in all cases, but I experiment a lot with learning different techniques. So I tried this 5-6 years back on one of the patient. It helped a bit, so it's something that you should keep in your mind. Interestingly, it's also very important gargle for sore throat. It's a very important remedy for hoarseness. Um, Also, it could be a very important remedy for frontal bone sinusitis and salivary gland related pathology. A lot of anxiety in this patient also. Thinking can be very difficult. There's a sensation in the frontal bone as if bone will fall out. Eyes painful, traumatic inflammation of eyes, and for cataract. Interestingly, um, very important for colic with backache. So cramp from stomach through both sides around to the back. So it is opposite of sabina, cochlearia. Interesting. Pain in the glans penis before during urination like petroselinum. Very important for upper respiratory tract infection. Dry cough, post influenza cough, and that's why it could be very important for COVID-19, where post influenza cough worse lying down like hyoscyamus. We should think about this cochlearia with hoarseness. So it would be very close to hyoscyamus for me. I told you about the back symptoms, aggravation at night. Interesting remedy. I haven't used it very much, but I think we can use this remedy a little bit more. One more interesting remedy, codeine. It's from opium family, Papaveracea family. Not much is known about this remedy, but it's a very important remedy for dry teasing cough. Whenever along with that, there is a lot of spasmodic symptom like twitching, especially of the eyelids. So twitching of the eyelids along with agaricos, mygale, this would be a very important remedy. Also very important for diabetes, typically. Pain from occiput, back of neck. Lot of pain in this remedy, but this is the main thing. If you see a lot of twitching in the eyelids and you don't know any other remedy, you should know codeine. Lot of thirst for bitter substances, which is interesting. The codeine is also known to be bitter. Lot of night cough, like hyoscyamus. So is something you should know. So this is what I'm going to finish my talk for today here. Boericke Materia Medica series. I hope you're watching it. Write to me what you feel about the talk. Email me. You have my email ID gaurang@gmail.com. And I hope that you're going to the next level. And I do hope that you're watching my series on Facebook, on YouTube, on Insta, on other series. And I hope that this lockdown, now we are going to open the lockdown very soon. And I hope that we can be better version of ourselves and keep refining.